There are injuries, and then there are injuries that make you stop mid-chart and go, you did what now? The human body is fragile, and apparently so is human judgment. That's why today we're diving into some of the hilarious, Hall of Fame, medically ridiculous mishaps. Let's call it some of the dumbest injuries known to man, real patients, real pain, and just split seconds between normal life and weeks living with crutches. You can't make this stuff up. I got a hernia from trying to push a fart out.
God.
What is a hernia? Usually it's a weakening within a layer of your abdominal wall. It could be your groin where a piece of tissue pops out. Now, if it goes in and out, that is fine. But if it gets stuck out and you can't push it back in, it increases the risk of an incarceration and then strangulation. So pushing a fart out too hard increases intra-abdominal pressure, which if there's a weakening within the abdominal wall can push out hernia contents. So it's not untrue, and just be careful. If a fart's not ready to come out, don't push so hard. Gave myself a black eye and fractured eye socket when trying to weigh my suitcase. The handle snapped and my clenched fist from holding it sprung back and clocked me in the face. I mean, it is not an abnormal event to happen and not really that dumb. It just happens. The black eye will go away on its own. Fractured eye socket, just depending on which bone is fractured. If it's, say, your infraorbital wall, you have the increased risk of having air go into your tissue. Something called subcutaneous emphysema if you sneeze or cough. So just make sure that you're aware of that and make sure you have like an open mouth, don't stifle it. And then you may or may not need to see an oral maxillofacial surgeon or plastic surgeon. Most of the time, these heal on their own. I am a realtor and was straightening up a house for a showing. Karate chopped the pillow as they do on decorating shows and broke my wrist. I mean, that is just unfortunate and maybe stupid. Know what you're karate chopping and know what's on the other side. You must have hit your wrist on something solid to snap it. Now, depending on what type of fracture, a very kind of common but not too bad fracture of, say, your wrist from a karate chop would be a styloid process fracture. It's like a little thing that sticks off the distal end of your bone that could break pretty easily. We have it on both sides. So for you to break both bones, you'd have to smack that pretty darn hard. Most of the time, that's probably not going to need surgery unless you really destroyed the distal end of that ulna. I ate spaghetti and dislocated my jaw. Spaghetti. Oh my gosh. So what happens is when somebody's opening their mouth really, really wide, a big yawn sometimes people will do, or they're trying to eat something too big and then it shifts. How do we put these back in or how do we fix them? We would give you some pain medicine, maybe a light sedative, just depending on the scenario. And we basically put our fingers in your mouth and grab onto the jaw, thumbs on the lower teeth. Usually we'll either put popsicle sticks surrounding our fingers or padding so we don't get bit by the patient accidentally. And we basically will pull forward and downward pressure to get it around the articulating surface so we can get it back into place. There are times if it's been out for too long or patient can't tolerate the maneuver, you may need to go to surgery to have this done. Hopefully this never happens to you, but if it has, let me know in the comments. I was laughing so hard at a friend tripping and falling that I actually ruptured a stomach muscle. So we have lots of muscles over our abdomen, right? You have your rectus abdominis, you have your transverse muscles, you have a bunch. And most likely somebody has ruptured their rectus abdominis, one of their six packs, so to speak. But usually you're not gonna have a complete tear. It could show up as a lot of pain as well as bruising to that area as it heals. Majority of the time you do not need surgery. It will repair itself. Anti-inflammatories, pain medication, resting, and time. I had to get 5 stitches and had nerve damage trying to open up a can of tuna. I mean, I can see how it easily happens as somebody who occasionally eats canned tuna because you're using that can opener and that metal makes a very sharp edge so you can slice right through it. The biggest thing is make sure you clean it out really, really well because there's a lot of potential bacteria there. And then see if you can have hemostasis by putting a lot of pressure on the area and see if you need stitches. When somebody comes to the emergency department, we will almost reopen the wound and make sure that everything is okay. You don't need anesthesia, you don't need lidocaine, anything like that. I dislocated my knee and partially blew my ACL while doing an online school exam. Did it by straightening my leg. Had to get surgery a year after because it didn't heal normally. When somebody dislocates their knee, their femur on the tibia or vice versa, you get worried about vascular compromise because the major blood vessels run behind the knee. So a lot of times we'll get a CT angio of the lower extremity to make sure the integrity of the blood vessels are still intact. Most of the time when we see ACL injuries, it's related to like physical activity, sports, changing angles or positions really quick. When somebody tears an ACL full, it swells up like nobody's business. Hard to get an MRI right away because it's going to be distorted with all the inflammation to be able to see exactly what's wrong. Typically what will happen is you will get medicines, immobilize crutches, see the swelling go down, and if there is still continued issues, have an MRI as an outpatient and then possible surgery by the orthopedic surgeon. Broke a rib trying to get a balloon off the ceiling. Interesting. A rib is very small, and depending on your circumstances, you could fracture a rib pretty easily. Patients come in quite often with rib pain, question fracture versus dislocation or just contusion. We will get images, but the treatment is all the same. Pain medication, deep breathing exercises, and time. Now, the big things that we worry about when somebody does have a rib fracture is the lung. A lot of times, if it is a displaced rib fracture, that rib becomes a sharp knife when broken, so it can stab into the lung, causing a puncture in the lung, causing it to have issues. Both need to be treated by a trauma surgeon. My hamster bit my toe. I was on heavy-duty painkillers, antibiotics, crutches, and had an infected big toe. Well, that actually happens. So any bite, animal, human, can lead to infections of the skin, something called cellulitis. The reason why bites are a little bit more prone to getting infected is because they inoculate into the tissue, meaning a bite will embed bacteria deep into the tissue. So a lot of times a doctor would put you on antibiotics for an animal bite. So the animal bite will cause pain, but usually the infection will cause more pain. So that's why you're going to be placed on pain medication. And then if it hurts to walk on, the crutches. Sometimes bad bite wounds don't do well with oral antibiotics and might need IV antibiotics. So if you ever have a bite wound, you're on antibiotics and you feel like it's not getting better or even getting worse, get it rechecked and see, okay, maybe we need IV antibiotics and be admitted to the hospital. Not proud of this, but got drunk, threw up, and burst a blood vessel in my eye. My entire eye turned red and bloody, looking for weeks. This is actually something that is quite common, called a subchorionic hematoma or hemorrhage. This is due to the blood vessels on the whites of the eye bursting. They're not dangerous, they're very scary looking, but they will go away on their own. We see patients who get this from having a lot of coughing, rubbing their eye, a lot of pressure due to vomiting. Things like this happen. It's when it's very painful that you need to have your eye checked. But again, a subchorionic hemorrhage or hematoma will go away on its own, is painless, and should not leave lasting damage. Well, some might call that a wild night, but in the ER, we might just call that poor decisions. Coincidentally, that is the same name of a supplement that I helped formulate by my company Life Happens to help with alcohol, metabolism, and hydration. It's packed with electrolytes, milk thistle, and just enough B vitamins to make you question your life choices a little less. Poor Decisions, pregame smarter, and find it on Amazon or lifehappens.com. Like the cartoons, I actually slipped on a banana peel in a parking lot and broke my tailbone.
Hey, what the?
Oh, that's awful. So yes, it's a slippery surface. So when people refer to the tailbone, they're referring to your coccyx. The coccyx is the end bone attached to the sacrum, which then attaches to the lumbar, all the way back up. And it hurts like the dickens. Basically, it's the same as if you bruised it, fractured it. There's nothing that we can do about it. Sit on a donut, pain medications, and pray that it just goes away ASAP, but it's going to take a little time to heal, just like any other fractured bone. This doesn't seem dumb, and it just seems unfortunate. Rolled over in bed, got a testicular torsion, had to have surgery to repair it. What is testicular torsion? That is when all the vessels in the cords gets twisted and you decrease blood supply to the testicle. Usually you need surgery, and what they end up doing is just tacking it to the structures within the scrotum itself to prevent it from rotating. If you don't get it fixed in a timely manner, you can actually have a dead testicle. But if you still have the other testicle, it should not interfere with fertility as well as sex drive or anything related to testosterone. I gave myself a concussion while sneezing and opening the fridge at the same time. So you sneeze, you smack your head, and you wake up on the floor, and that hurts. When the body drops because you're unconscious, you're not protecting yourself, so you have increased risk of head injury, increased risk of intracranial bleeding, cervical fractures. So when somebody wakes up, if they don't come to the hospital complaining of a headache, we're definitely going to get a CT scan of the head. But if you're feeling fine, then you're probably going to be doing okay. You should observe yourself for 4 to 6 hours and make sure you don't have any neurologic symptoms or any abnormal mental status changes. If you do, get to the hospital ASAP. Okay, these are kind of funny, cute, but I guess for me as an ER doctor, they're not that dumb because they're common. It does happen. But let me know in the comments if you have had any of these unique, maybe say dumb accidents, not maybe the worst injuries, but some that you just question telling people because you might feel embarrassed. Let me know in the comments. And as always, do me a favor, make sure you binge watch this playlist right here. Watch it all for me. And do me a favor, subscribe, turn on the bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.